Well, taking the first step towards recovery is a courageous decision, and Recovery Centers of Arkansas is ready to walk alongside you every step of the way. CEO David Bradshaw is here to explain how they can be a resource for those seeking treatment. David, great to have you. Thank you for being here.
Thank you, Steve. Thanks for having us.
You're welcome, and thank you for all you do. Let's talk a little bit about Recovery Centers of Arkansas and what you do.
So Recovery Centers of Arkansas is a nonprofit organization, and we provide treatment for those who are struggling with addiction. We also provide treatment for co-occurring disorders, meaning depression, anxiety, trauma, and many other disorders. With that said, we have multiple sites, 3 different sites where we provide residential treatment. We also provide a great continuum of care where there's outpatient services to step down to after one finishes the residential program.
So wherever you are in your recovery journey, you have something for them. Right?
Absolutely.
Yeah.
Absolutely.
David, I know the place that you now lead is near and dear to your heart because you've been the CEO for the past 4 years, but you've been with RCA a lot longer than that.
That's right. I've been with Recovery Centers of Arkansas for 14 years. Fell in love with this population. I tell you, it's a blessing to be able to help people. And having been the clinical director of OASIS Renewal Center for 10 years and helping that get started, being there in the beginning where it was a very, very small staff and it growing into what it is today with an outstanding 24-bed residential program, an outstanding outpatient program for PHP 5 days a week and IOP 3 days a week, and then now being able to move into the director's position. I see this in my role as an opportunity to give other treatment providers the opportunity I had. Yeah. It's amazing to be able to touch people's lives in this way.
Yes, the gratification that you must feel to see somebody who comes to you truly in one of the lowest points of their life and to be able to turn it around and get their lives back together. There can't be anything better than that as a care provider.
I tell you, there was days that when I would walk out to go home, and it'd be late because it is hard work, that I'd just be thanking God for that opportunity to be able, that someone would open up and really talk and talk about things they never had the opportunity to talk about.
Yeah.
Things that they needed to get off of their chest, things that they've been carrying around as a burden for a long time.
Yeah.
Yeah.
If someone is watching this now, has a loved one or themselves feel like they need to seek help, what would you tell them to do?
Oh, absolutely. First of all, know that you're not alone. Know that this is a medical condition. It's not a moral failure. There's no judgment to come, and don't be afraid. Just come and ask for help. There's things that you can do. You might talk to a friend first, a friend that you trust. You may talk to someone, in a local group that you're a part of, or a church. But there's also the opportunity to call providers like us. We're easy to reach, and anything that we can do to maybe take the sting out, take the fear away.
Yeah, that's what I was going to ask, because when somebody comes to the recognition in their life that they need to do something to help themselves, what is their biggest anxiety? That this is going to be embarrassing, it's going to be scary, it's going to take too long, it's going to cost me too much. Absolutely. What is it that they're most worried about?
I think it's all of the above, because our mind goes to racing. Keep in mind that individuals are already struggling with other disorders like depression and anxiety, trauma. That just complicates the fears, and so everything you just listed is part of it. But I think maybe one of the bigger parts is maybe fear of failure. Maybe fear of success, but also many times it's the fear of being judged. It's the stigma that sometimes keeps people from asking for help.
Well, they're not alone.
That's right.
For sure. David, if people want to reach out to Recovery Centers of Arkansas, what would you recommend?
Just go to our website, Recovery Centers of Arkansas, rcaga.org. And that will lead you to all of our sites and tell you about the services we provide. If someone wants a tour, we would be glad to sit down with that individual again to reduce some of their fears, to let them know what to expect when they come to treatment, sometimes the fear is of the withdrawals that folks will go through, and we have answers for that. So there is hope. There is hope for folks getting this help they need.
Well, we are blessed that you all are here, and the scarier option is not doing anything at all about it.
Right. That's right. You know, one of the big factors is a readiness to change. So many times people are just, they're not ready. They may come and they may leave quickly. And I think that part of the readiness factor, someone has to reach a place where the pain of remaining the same is much greater than the pain of changing. Yeah. It's a big deal. So I think, too, to give folks hope to know what to expect, we have evidence-based practices. We have models of therapy that have outcomes where it is making a difference in people's lives. There's also medication-assisted treatment for cravings. There's also psychiatry where we treat those co-occurring disorders. There are answers.
There are options for you for sure. David, I know folks are in good hands when they come to Recovery Centers of Arkansas. Thank you. I enjoyed talking to you very much.
Thank you, Steve. I appreciate it.
All right, coming back on Good Morning Arkansas right after this. Don't go away.